Alright, now this will happen to be our first video as related to gastrointestinal issues, and this is introduction towards gastrointestinal pathology. Of course, that's a pathology we are moving into. Alright, that's a pathology we are moving into. So gastrointestinal system pathology. So this one is just all about disease conditions that occur in the stomach, both the ones that you're born with and also the ones that you can actually inherit. Okay, so congenital ones and also acquired ones. So gastrointestinal pathology is also, is even a subspecialty of its own of surgery, and it focuses on trying to diagnose and characterize what disease conditions that could occur to the digestive tract, okay, and also what the various organs that are related to the digestive tract. Digestive tract is from the nose, from the mouth to the esophagus to the stomach to the small intestine, large intestine, rectum, anus. You understand? So GI pathology, said I say, it deals with any disease of the gastrointestinal system from the mouth to the anus, and also the organs that actually are alongside this system. So you study the structures, study the functions, study inflammatory disease, study infectious disease, and study all those benign tumors, cancerous tumors that could actually occur in the gastrointestinal system. So of course, if you have a good knowledge of this, it will give you a very good knowledge of diagnosing gastrointestinal system disease, which are actually quite very common disease conditions in our environment. So understanding the GI tract, you should know that you have to have good knowledge of the layers. You have to have good knowledge of the cells, because sometimes our individual cells of the gastrointestinal system can be affected. Okay, then you also have to know about all the other organs that are alongside the gastrointestinal system. So when talking about disease conditions of the gastrointestinal system, you first of all you classify the different parts. Okay, so when you classify the different parts, then you can now say this part so disease affected, so disease affected. So in the esophagus, we get to talk about the gastroesophageal reflux disease. We'll talk about the Barrett's esophagus, which is also like a complication of gastroesophageal reflux disease. The epithelium in the esophagus is kind of like being replaced because it wants to adapt to the acid. Then we'll talk about the squamous carcinomas and adenocarcinomas. In the stomach, we'll talk about inflammation of the stomach, that's gastritis. We'll talk about peptic ulcer. We'll talk about the Meniere's disease. We'll talk about gastric carcinoma. In the small intestine, we'll talk about celiac disease. We'll talk about Crohn's disease. We'll talk about infections and tumors. In the colon and rectum, we'll talk about ulcerative colitis, polyps, colorectal carcinoma. So we'll also talk about appendicitis, hepatitis, liver cirrhosis, cholecystitis, gallstones, pancreatitis, cancers of the pancreas. We'll have fun. All right. So clinical importance is you get to know how to diagnose disease conditions of the gastrointestinal system. You get to know the treatment approach to diagnosing disease conditions of the gastrointestinal system, and you get to have a lot of important knowledge that will help you later on in your life if you want to do any research as related to this part of medicine. Okay.